Well, I was living on the island of Oahu in Hawaii, and was very happy there. I liked Hawaii very much. But over the years, the island had become a lot more overdeveloped. But for over 20 years, I had been wanting to live and work in Australia. But I felt that this was the perfect time for me to come over to Australia and work. I wasn't sure where I would want to settle down. It's kind of hard to pick a place to live from 5,000 miles away. So I decided the best way to see parts of Australia and also decide where I might want to live would be to do a locums. And basically with the locums, you're filling in for doctors who are sick or on vacation and help out in any way you can. And each assignment is different. Some assignments have a lot of hospital work, some have no hospital work. So you have to be very varied in your skills and abilities to deal with different situations. Right now I'm in the town of Hay on the Murrumbidgee River, and let's see, it's got I think about 3,500 people in the Shire. It's a beautiful old town. They have a lot of restored buildings. Well, working as a locums in the bush involves a lot of different aspects. There's usually a lot of driving, at least in between assignments. I'd say probably at least 200 to 300 kilometers between different assignments, and sometimes more. I also, when you get to an assignment, usually involves working in the doctor's surgery and as well as in the hospital. Call may vary. Some places have had no call, and some places have had frequent call. Call may be very busy, or just an occasional call into the hospital at night. It varies quite a bit. Most of the work is similar to work you do anywhere. I mean, the doctor's surgeries are basically very similar and involve seeing a whole range of outpatient medicine from infants on to the elderly, and taking care of male and female and the usual range. The emergency room or accident wards have the usual range as well, anything from colds to major trauma. So it varies a great deal, and that's one of the, I think, attractions of working out in the bush and doing locums work, is that you do get the variety to maintain all your skills and keep you up on everything. Well, I think the things that I found very rewarding is that because there aren't enough physicians in the bush, people are very appreciative of any help you give them, and especially if you go out of your way to take care of extra problems, even though they may have come in for only one issue. People really are very appreciative, and that gives you a good feeling and makes practicing medicine a lot more rewarding. Well, I don't think that it is really all that difficult practicing in the bush. People are wonderful. Lifestyle is very nice. I think it's more of your own mental picture a lot of times that you have to overcome. Once you get into the practice, things seem to fall in place. There are support services. If you can't handle things, there are doctors available by phone, or you can transfer a patient out. The lifestyle is wonderful. It's just a matter of adjusting to it. I've lived in several parts of the United States, and each city, desert, Hawaii, and each place I lived in required a change in a mental adjustment. And I think once you do that, once you realize that you don't have to see a concert every week and be to keep in touch with humanity and what's going on in the world, you can your own interactions with people here is much more important.
Yeah, he's discussed it with you guys.
I don't think it's been too difficult adjusting to the way Australians do things. I really enjoy the Australian sense of humor. It's but I have to listen carefully because it's very short, and an Australian will make a joke and say a lot in just a couple words, and so you have to really pay attention, and especially because they may not be talking very loudly, and so you have to really listen carefully. Other than that, it's been very easy getting along with Australians. They are very open, very honest, and tell you what they're thinking, and it's very refreshing to deal with people like that. Well, it's actually very easy getting to work in New South Wales thanks to the Rural Doctors Network. They took care of all the paperwork. I just had to fill out the forms and submit them, and basically it was a very painless process. It was more difficult getting my license in some of the states in the United States than it was getting to work over here. I did go before the New South Wales Medical Board for an interview, and apparently I passed it, otherwise I wouldn't be here. And it was just routine clinical questions, and they just wanted to test my knowledge to see if I knew what I was doing. So basically, the whole process wasn't that difficult. Of course, I had been in practice for 20 years in the United States before coming out here, and so I'm sure that helped. Maybe a new graduate would find it a little more difficult, but it seemed like a very reasonable process to me to ensure the safety of providers of medical care to the Australian public. Patients here have just been very appreciative of every little thing you do, and understand that there's been a lot more work involved besides just what they see in front of them as far as what you're doing for their health care. And that's been the best part of the whole trip for me so far, is meeting the people and their friendliness and openness. Well, I went into medicine because I enjoyed dealing with people, and that's why I stayed in general practice and wanted to help make a difference. You really feel that you can make a difference out in the bush here because your own abilities and energy readily translates into improvements in other people's lives. And that's been, I think, the most rewarding. You feel that your own individuality can make a difference, and I enjoyed that. I like seeing that I'm not just another worker in a big system. What I do and how I act does make a difference in individuals' lives, and that does happen here out in the bush.